Good afternoon, Professor Jennifer Leaning, and good afternoon, dear members of the atrocity prevention community and also public health prevention community. We are here realizing our third interview with Professor Leaning. Thank you, Jennifer, very much to be with us and to continue this effort with us. We are still trying to elicit lessons learned from this pandemic for atrocity prevention. And I was very impressed during our last interview when you said something very simple, but which is actually quite complex. You said one of the conditions to be able to develop a sound prevention policy, be it in public health or be it in atrocity prevention, is to know your own vulnerabilities as a society. And I thought this would be a good departure point for this interview that we are realizing today. In particular, we are going to try with the third interview to summarize the main lessons learned. So let's take this idea that it's important to know your own vulnerability as a society. And you mentioned one in particular during our last conversation. It was the absence of dealing with your own past as a society and the issues of slavery and past atrocity. So what does COVID teaches us in terms of atrocity prevention in this regard? You evoked also structural vulnerabilities, cultural and sense of ideological, the management of diversity, as well as political elements. So what would you like to share with us on this issue, Jennifer? Thank you.
Well, thank you, Mo, and it's an honor again to be with you in this discussion, and greetings to those of you who are watching. We must, in the course of our lives, interrogate our own societies. And what you understand about your country when you're 10 years old will partly depend on what you've learned in school and what your parents and grandparents have told you. And I would say that in the United States, there are a large number of people, I have no idea what the percentage is, but there are a large number of people who will not have had good schools by the time they're 10 years old, and who are quite likely not to be in touch with their grandparents for a range of reasons, and may not have two parents to talk to. And the parent they may have, and even that is lucky usually, it may not have been educated in the United States, may not actually have a strong sense of history, could be a very good computer scientist. But so a big issue in the United States is that we are a country of over 350 million people, and we don't have a common narrative about who we are. And so that sustains fissures in our communications with each other. And we have to tread gently when there are issues that hit the nation or that bubble up from the society that require an explanation. Why is this happening? So for instance, there's been a very big and steady campaign that's called Black Lives Matter in the United States, which arose out of a series of what appears to be relatively arbitrary shootings of Black men and women, even some teenagers, by local city or primarily local and city police in a number of cities around the country. And it is, and it's created a great deal of discussion in the United States because we have pretty good laws around hate speech and pretty good laws around hate crimes. And the question that was in the air is, are these killings that are too easily accomplished because of the weaponry the police carry, and also because of their stance towards what they may perceive as disorderly conduct, even community unrest within the cities. So you have two narratives that collide quite quickly and with a lot of historical bitterness. And so when we talk about knowing our society, the first thing I would say is, first of all, it needs to be your society. I mean, I'm very interested in other societies, and I know a number of people watching this are. And some know other societies far better than I in the context of American education. All right, but knowing America, the United States, we are a singularly continent-bound country. Most of us don't speak other languages well. And a lot of us don't have passports. What we learned with Hurricane Katrina in 2005, when we were asking people to evacuate, helping them to evacuate from a very, very destructive hurricane. This was in New Orleans on the Gulf of Mexico. We realized that people didn't have access to cars. That was sort of understood, but they'd never learned to drive. There weren't any buses that would go north out of New Orleans. There was only one road, and that was jammed. And that there was a tremendous amount of fear in the African-American community about getting out of New Orleans because the rest of the United States was unknown and in their minds, potentially dangerous.
Okay, if I may, Jennifer, at this very stage of what you are saying. So basically, you are saying that hit by Katrina or hit by the COVID, suddenly, or other kind of situation, man-made disasters, etc., suddenly it's inequalities, structural inequalities, etc., are suddenly being revealed, right? So are you telling us that basically to have an efficient prevention, these are elements that you need to know before this pandemic or these incidents are taking place?
Yes. What I'm saying is the United States is riven by racial and socioeconomic tensions. And we gingerly try to share language around these issues in the public space, but it's very, very difficult. And I think there are a number of people who are watching the discourse around COVID-19 and are horrified by the racial imbalance in the death rate. So the United States is somewhere around 12 to 13% African American, and around 5%, 12% Hispanic, and around 5% Asian American. And those discourses coming out of what the color of your skin is or your ethnicity cannot be stereotyped because everybody's different. But in the United States, a very big weakness is that people get categorized by what they look like. And that, I think, is a human, not just United States tendency or instinct, but the categories of who you are very fixed and clouded with stereotype.
Now, in this particular regard, of course, the leadership plays an absolute crucial role. This leads us to the next step. So, and you see it in your country, and you see it in other country. It's quite amazing how in certain contexts, leaders have misused the situation to basically not act for the common good, but for their own position. And in other contexts, you have seen the development or suddenly the emergence of absolutely remarkable leaders acting for the common good. So, what kind of leadership do you need, Jennifer, when you are confronted with a serious public health emergency or a serious threat for atrocities? What kind of leadership do we need? And how can we strengthen such a leadership or encourage it to come?
Well, first of all, there's structural issues around recruitment of leadership, training of leaders, how they manage their office and their power and their authority. And I'd like to give an example of a period of time, an instance of time really in the United States immediately after the terrorist bombings in 9/11. So this is 2001, September 11th. And the city of New York was, devastated. And all of the doctors and nurses in New York immediately went to the emergency departments because everybody saw the two towers fall. And they went there to handle the casualties. And there were no casualties, very few. And this sense of dismay and disbelief went through the medical community and then very quickly through the rest of the city and then the country. And then started this very long process of going through the rubble. And the quest for human remains in that rubble was astonishing to me. I understood it. Many people died and their families yearned for something that they could find, and honor and then bury in their own religious or secular traditions. And Rudolph Giuliani, who at that point was not a particularly well-known mayor of New York, and who since has not been as stunningly powerful as he was then, surprised all of us. He set up press conferences at the site, and 2 or 3 times a day had these for, I don't know, it feels as if it was weeks. It may not have been that long. And he did 2 amazingly important things for leadership. One is he was somber and serious, but stood at the stand, it was usually outside, with all his chiefs of service, the head of the fire, the head of the police, the head of the construction company that was doing this or that, the mortuary people who were basically sifting through and identifying bones. And he would take questions, any questions. And there was a huge crowd of press, but it was also on national and to some extent world television. So one could have been very nervous. And he was calm, quiet, didn't say much. He's not a particularly eloquent man. And as I say, people were seeing him for the first time really in one of the most consequential crises of the century, or the end of the century, the start of the century. And it was a pivotal time as we were going in a world way through one epoch to another. And he asked others to help him answer the questions. There would be a question from the press, well, Governor, what are you finding as you sift through the remains? And then he would turn to the people that were responsible for that. And he said, it's, that's an important question. He'd honor the question. And then he would say, could I ask so-and-so? And then he'd step back and then that person would come to the podium and talk. So you saw all of the New York City leadership before you, and you got a sense that he was surrounded by very stable and technically knowledgeable, but also humane people. So there was a sense of comfort, that this is not just one man winging it, right? This was a solid group of people whose lives were equally disrupted and who were focused on the right things. The second point about it, so this was generosity of shared leadership, demonstrated dramatic good delegation, a window into how the leaders of that city were thinking. So those of us watching were saying, it's okay. These are good guys. They're doing as much as they possibly can to support us. The other aspect, which was unexpected, was that he occasionally would rise to real eloquence. I mean, his language would get elegant. And in a polyglot society like the United States, it's not recognized really how much those who speak commanding English with the right cadence draw people's attention. Martin Luther King, of course, John F. Kennedy, of course, Franklin Delano Roosevelt, the president during World War II. So you can be educated in different traditions, but and people coming out of our variety of churches in the United States actually can capture that sort of biblical way of speaking. So he was asked early on, maybe day 2, how many people, Mr. Mayor, have died in this catastrophe? And I recall he looked down and then he looked back up, and he wasn't really talking to anyone in particular. And he said, we were already getting used to his looking to people to answer the questions. And he looked up and he just looked directly into the cameras. And he said, I don't know, but I can tell you the number will be more than we can bear. I mean, it was so moving. And so he got all of us, we were going to then, I mean, I'm speaking just as someone who was in Boston and about to go down to help, and then realized there was not that much that I would be helpful in. So as, much as one can discuss what Rudolph Giuliani is doing now, I have a sense of high respect for what he did in that point. And we could talk about other places of leadership that are common understanding for the world. But those to me are 2 elements.
Yeah, Jennifer, what you are saying, I think is very important, because actually when we see now the situation with COVID, or we see other contexts in which people had to stand up to avoid the repetition of atrocity, for example. We have seen leaders with standing up with a leadership, and you said a shared leadership, meaning the capacity to convene others. So it's not me, myself, and I, it's really others for the common good. So I think that's extremely important. You have spoken about the importance of knowledge. And here we see how important it is to have scientists, for example, sharing facts and not fake information. So a leadership that is not only convening a broad constituency, diverse, speaking for a political party or speaking for a common good. She is capable also to put knowledge on the table, facts and figures for what they are in the very day, and to delegate, which is to share its power. So this is this shared leadership that you put as a label. You also spoke about the language which is the capacity to honestly be capable to say, this is what we know as for now, as for today, and this is what we don't know. So I understand that there is a certain capacity to be not only honest, transparent, but also to be the one that shares the idea that even if it's very insecure or very unknown what's happening exactly, we can stand together around what we know. And because we are acting and communicating like this, and this is for me predictability and transparency, that we can go along together. As we go along, we will discover other elements, other catastrophes, but as we do this way, so it's both this element of sharing leadership, transparency, predictability, and are there some situation in public health, for example, that has struck you in showing this kind of virtue or leadership?
Yes, it it's rare to see it in the public space because, say, the heads of the Center for Disease Control, or the head of the U.S. Public Health Service, or even the head of the Department of Health and Human Services in this country, is considered a high-powered technical person with, vast managerial capacities and scientific knowledge. So getting those two together is really important for people in those leadership roles. To attach to that a capacity to convey compassion and connection with a large sector of the population is sometimes unusual. But I would say that during the HIV/AIDS epidemic in this country, we had a couple of people who were heads of the CDC or very high up in the Public Health Service who also happened to have extensive knowledge in virology, who had a very calming influence. Not early on, there was a lot of anxiety and stigmatization, but who had a calming influence on normalizing this illness, saying what it was and what it wasn't, and also saying that we are working on a way to mitigate it and stop it and eventually cure it. And this is a 15, 20-year process going from the early 1980s on. And so that we're seeing, interestingly, a recapitulation of that kind of public health leadership in the United States. There are ways in which, people are saying that Dr. Fauci should, get a Nobel Peace Prize. I mean, which is, the best thing you can in the United States think about in terms of conferring honor and public acclaim. There's a great deal of respect for the Nobel Peace Prize. And I'm not commenting one way or the other, but he's walking a very narrow line here in terms of the trust that he has built in the American public for cautiously still being able to speak truth to power, cautiously, is, I know, one of the things that is keeping him in that role. It's tremendous strain, but he continues to be there. He gets isolated sometimes, and then he comes back up, and you see him at the podium. So I would say Dr. Fauci is playing an excellent role now, and it's a precarious one. It's a brave role, and we need it. So this is an unlikely candidate for someone who could handle this public pressure. We've all known him as an excellent scientist, but over these last months, we can also see that he has how would I put it? A reluctant understanding that his voice matters, and people watch the choreography of whether he's standing, behind the president, or whether he's sitting off to the side, or whether he's not there. These are the three elements of reports on a news conference. They're almost always highlighted in the newspapers or the commentary that follows. Where was Dr. Fauci? So I would say that another aspect of leadership in the public health realm is that one has to recognize that it's not ever a disease or an illness that is the focus of public inquiry and public need from a leader. It is to know that somebody else knows the details and is working for the public good. That's the message that has to come out of public health leadership.
So basically, you are giving us a portrait of public servants by excellence. And I love this formula because they are serving the common good, and they are serving the public common good, which are the conditions under which you can have a shared leadership, right? Because you are not doing this for your own party, your own self, and that's this importance of knowledge, that all this is sustained by knowledge and fact. So you are surrounded by people who give you concrete informations which are correct, which are cross-checked, and you also can, in this kind of very turbulent time, take notice of the fact that, as for today, you don't know more than these facts, but because you are leading in this shared leadership, this process in this way, you know that you can act on it. And you said also that, and I think this is very important in the point before we were talking about the possibility also that while we prevent, even if we are in secondary prevention, we may actually contribute to transform these vulnerabilities into strengths or into less vulnerabilities, if I may say so. So what you are indicating, for example, is this capacity in this IHV campaign to overcome stigma and to overcome segregation. Mm-hmm. And I remember this situation. And so what the bet was, we have to overcome stigmatization against certain groups in order to be efficient with this prevention. And it was a huge lesson. Huh? Mm-hmm. And I would say that if we take these elements into the atrocity prevention, it tells us again about models of public servants which have played crucial roles in many situations in the world. And very recently, even if it goes and goes away again, but Angela Merkel standing up for refugees and saying Germany will receive refugees. Now the policy has changed, but that was also a kind of image, I would say, a comparable image to what you said before about the courage to stand up and overcome their own stigmas and own xenophobias or racism that exist in your own society, and stand up for common good as a public servant, right? But this said, I think this is all the kind of catalog of qualities that we might expect and that we might recommend to the prevention community to really, as we have to prepare the prevention community to act when a catastrophe is there, and to prevent it, really. So we might then also think about training leaders for that, and we might training this kind of capacity to be acting in this kind of surrounding. But it leads us to a more complex question, and that's a bit delicate to speak about that in going beyond generality, is this issue of political will. Well, if there are no such good public servants, if there is no such good shared leadership, if there are no such scientists that are somehow counseling these leaders, and then you have public leaders who are concentrating the power with no facts, no information, pure ideological maintenance, etc. So what could you tell us that derives from your experiences in public health or in atrocity prevention, in terms of what are the mechanisms that we can use in order to strengthen a political will that goes in the right direction? And we have many examples where actually this political will is not there. But we know that certain events, certain actors, and certain actions can contribute to reverse this situation. What could you share with us regarding this matter?
Well, I would begin by saying that there are not many that come forward often. And that for decades, I think we have, since the Vietnam War in the United States, so that goes back to the late 60s to mid 70s, we have as a society, not appreciated the young people or the older people who come forward to demonstrate, who take on public action out of a space that they had not expected to enter, who speak out of conscience and concern, and have a quiet authority that no one really would have recognized except in a small social circle, finds himself or herself in a place where you either have to publicly say no, or you publicly have to say yes to some trends that are happening in your society. And that what is often interesting is that some of these people who have an inner integrity and stand up against what is just considered the last straw in terms of public policy or public opinion, they are not ready to be in the limelight, and they can crumble under it. And this comes back to how you nurture a society to be brave, that in so many respects, a leader cannot lead a very big country or even a small country into a better place unless there are nodes of support, of separate courage, and unexpected mobilization on his or her behalf. You need it in the cities, you need it in the countryside, you need people who essentially are often unsung heroes. And occasionally you hear about them or you meet them. And I would say that this is what is, I'm getting back to how the school system works. This to me is how you can raise a society to honor those who stand up for something. Or in sort of African-American mobilization policies, be somebody, or I am somebody. This sense of self-worth and integrity comes through, good churches and synagogues and temples, and it comes through a set of modeling and encouragement that can be done by good teachers in school. And I deeply believe that if we're thinking about atrocity prevention and leadership, we need to be training, educating, inspiring young people to recognize that even in vast continents and big countries, they can make a very big difference.
Professor Lening, I think it's very interesting to listen to all the list of elements that you just shared with us. Actually, for a person like me, I strongly believe, in analogy to public health prevention, that prevention of atrocity begins early. So we should be prepared before anything happens, but it's a continuous process of adaptation, right? So what I was taking some notes from me while listening to you, and I'm thinking that for the ones, or to the ones who say that actually it's very difficult to measure prevention of atrocity results because actually you should measure something that does not happen. And I would say I don't agree with that, because what we do when we really prevent, we are not speaking about an intervention when the catastrophe is already there or atrocity have already happened or they will happen tomorrow. I'm speaking in echo with you to build constituencies who are ready to understand the signals that's showing that, for example, hate speech is growing, stigmatization against a specific group are growing, politicians are taking positions in this direction, etc. So they might use legal existing frameworks. They might use the parliament also to counter these kind of elements. So basically, this constituency might be the counterpower when a leadership tends to act negatively. So all these checks and balances shall be strengthened. So these are results that we can measure actually in prevention. This is rule of law, this is the justice system, this is in societies where the state is not present everywhere, this is strengthening the presence of the state everywhere. This is also legal framework, functioning, being respected, human rights policy. So these are all things that we can measure. Would we label them and wish to do that? And there I think we have to make a real transformation, I would say, to be capable to understand ourselves in a prevention mood or a prevention narrative, and we do that. All this is preparing a society to be constituencies, to be acting properly, as you said, to stand up in the right moment for the right event, and to say, no, we have actually principles, we have legal frameworks, and this goes beyond what is tolerable for the common good. At the same time, this in turns contribute to create other kinds of attitudes, right? That you were describing so well in people who launch this campaign, for example, Black Lives Matters, or we are all going to go out of that together. We will leave no one behind. And this attitude can be changed because you have, through education and through this kind of effort, being able to acquire a minimum of critical sense, of a sense of common good, precisely, and which is not part of the common good, or what acts against this common good, which is not only the sum of my family and my friends, but which is really the sum of all my fellow citizens. So education for that is crucial, but I would believe that, and there you might have example in public health, but the fact that you are there, for example, you, Professor Leaning, and that you are capable with your colleagues to see some public health problems arriving there, and that you can talk with them, analyze the situation with them before it even arrives, and discuss about what possible step if, something more serious happens, is already something that we can measure. It's something that we can write about. It's something that we can talk about. I think when I'm hearing you, I think the big challenge now for GAMAC, for all the ones who are working in prevention, is maybe perhaps to begin to solidify and to strengthen a narrative about prevention before it's getting into movement. What is your take on that?
Yes, I agree with you. I think that people need to see in themselves some of the heroism potential that you see actually fully realized in the actions of ordinary people now in COVID-19. The media are doing, this is in the United States now, the media are doing a good job of telling the life stories of people who have died or who have lived or still in that long shadowland that a serious illness like COVID-19 creates. In other words, you're in the hospital and it's not which way you're going to go. And it allows those of us who don't know that person to realize what sorts of lives people are now managing to create for themselves in a context of very little money, an endlessly tiresome job, children and responsibilities, and yet they still go to the hospital and they still do the work that they are supposed to do. And some of them fall ill and some of them die. And then you realize they've done all of that, because that's their role. That's what they think is important. And it's an extraordinary window into the devotion of ordinary people to something larger than themselves. We're seeing enormous numbers of people who have not become selfish, but have become more generous and giving. And some of them are paying it for it with their lives. And I would suggest that we not consider them extraordinary in this sense. They are truly extraordinary, but they are not way out of the ordinary. We need to be igniting small sparks of potential heroism in all of us. Be thinking about, would I do this or that? So that's one aspect that is a psychological modeling, educational aspect of atrocity prevention. To have you realize that out of one can come many. But the other point that I'd like to make is that it's very important to look at what this disease is showing us about the huge structural issues in your society. Because this tussle right now, which is everywhere, as to whether release restrictions so people can go back to work or not. And it's not splitting easily, as far as I can tell, in the United States along obvious socioeconomic lines. And the interesting argument here is that there's very good rationale on both sides of the argument, very good rationale. And so how we, as societies, balance the concern of public health about the spread of an illness with public health needs to be aware of this, the larger concern of a growing number of people, particularly in a country that does not have social safety nets, which is the United States, that if they don't work, their lives crumble, and some already are. And so I'm acutely aware of this just where I am. We're opening up a little bit. A large number of us are still vulnerable to the virus. I'm empathetic about the need for people carefully to go back to work. And the other aspect of this is that we are all having a good time recognizing how social we are as human beings. That as good as Zoom is and as good as whatever media you have at home, people are now starting to crave human interaction directly. That is, coffee shops and streets and shops open. And so I think we need to be very tolerant of each other and loving, recognizing that now we're not in a really clear public health mode where the science in many ways would state we have to be careful. Even within the public health community, there are an increasing number of people saying, how are we going to transition back to normal, in quotes, when there's still large numbers of people that are completely naive to this virus. And so this is where the push to get a vaccine is really being accelerated. But in this period of time, social distancing, social community, and a recognition of the mixed needs that come out of your own social and economic circumstances is creating conversations in this country that we have not had with each other. And I think this would be a leadership opportunity, which I think is being missed in the US, to have conversations about who we are as a country, who must desperately have a job because there isn't any other way of getting healthcare, who actually lives on the day's wages he or she earns. This is a conversation you could have in India and it would not be interesting to people because it's so clear how many people are in that setting. In the United States, it would be instructive, I think, and part of a collective inquiry that I think could build community.
Professor Lining, you are somehow giving us a lot of light and hope. Basically, we have been talking about the importance to know your vulnerability and the fact that crises and pandemics and periods of man-made catastrophes such as atrocity are revealing both the very sound and profound vulnerabilities of a society, such as exclusion, racism, xenophobia, discrimination, but also the extraordinary strengths that any human community might have. Mm-hmm. We have said then that serious leadership and a constructive leadership, while sharing its leadership with, for example, in the case of public health, as we see now, scientists who can rely on facts and figures, which are not fake news, but which are solid. Leadership centered around common good, and speaking in a very honest manner and standing there with this community with whom she shares the leadership in this crisis moment, can in the same time also contribute to address these vulnerabilities through a constructive and very vulnerability sensitive prevention policy, even in the secondary prevention. It can make a difference. We have also underlined the extraordinary role that individuals, professionals, who are just playing their role and who are proud to be professional, whoever they are. And I'm thinking also about the cleaning women and men, you know, the people who are cleaning the trains and the buses and the hospitals, and of course the nurses and the doctors, etc., who have been in the front line. This sense of dignity based on playing your role in a moment in which it's important is all transmitted through education. And that brings us back in turn to the fact that definitively today we can say that no, prevention is not non-measurable. Prevention is a permanent action, is absolutely measurable because it transmits through education this sense of dignity, this sense of fulfillment of your role as a person in society, transmits also the capacity to potential future leaders to work for a common good. It also is there to strengthen legal frameworks, checks and balances, principles for any society to be able to work and live together peacefully. And therefore, these permanent constituencies that are working in silence, and sometimes we know extraordinary results to show, but preventively to combat hate speech or to combat racism. And I cannot not think now about this more than 15 national committees on prevention of atrocities or hate speech or peace council, whatever the name they have. For example, in Africa, where that Professor Liberata Mula, Ambassador Liberata Mula was so instrumental to create. And they are the ones on the ground. And because they exist in a permanent manner, and this is what we would like as GAMAC to see emerging everywhere, they are capable much before this catastrophe arises to be there already as constituencies that are capable, because they have been preparing for that, to do what you are saying that we shall do. Stand up for principles, work for the common good, be proud of the role that each of us, men, women, young people, elderlies, etc., can play, because we are just playing humbly our role. And the common denominator, this common good, and the fact that we are all together in it, and we will go out all together in it. And I think this is a wonderful narrative of prevention. We have tried during these 3 interviews to build a series of, I would say, bridges between public health preventions and atrocity prevention. I think we have seen a lot of commonalities. And I would like to thank you so much, Professor Liening, for all this teaching and lessons you have been sharing with us. I wish we will pursue this conversation in the next months. This is in this forum the last interview that we are going to do, and hopefully we are going to realize another interview with you maybe later in the year to make a kind of recap and other reflection on the lessons learned we can take from this whole period. So thank you very much. And I don't know, maybe you want to address, as for now, for this last interview in these months of May. Last message of yours to the Gamma community and to the prevention community out there that has been looking at us.
Yes. Well, thank you, Mo. It has been a privilege to have these conversations with you. And it has also been a bit of a constraint on my thinking to realize that there are others watching with tremendous background on these topics. So I feel humbled by the opportunity to engage with you and with GAMIC. And I have been associated with GAMIC for quite a long time, I think. You've had the idea for much longer, but I've been with a small group of people for quite a long time associated with GAMIC. And it has come to be a very important part of my intellectual profile and my moral life. And I honor all of you for being part of this very dynamic, brave group. And I would like to continue working with you, with Sylvia Fernandez, with all of the GAMIC network of people, with the Swiss Support Office. And I believe that we, if we have to be, we are now much more mobilized and fortified to respond in our own ways to outbreaks of atrocity. I truly believe that. And I look forward to enlisting a process of education and mobilization and inspiration that will bring more people to this sort of platform and to the understanding of group strength that will be required to fight atrocity crimes. So thank you.
Thank you, Jennifer. Thank you very much. And we continue the fight, we continue the journey. And to the viewers, stay tuned. We'll come with other interviews and the conversation continues. Thank you very much.
Thank you very much. Okay, bye-bye.